Hey guys, how you doing? My name is Mike. The reason why I'm making this video is because today I'm in day one of my recovery from a lumbar discectomy surgery that I got today. I got home a few hours ago. I'm doing okay. Basically, the pain that I'm feeling right now is mainly in my lower back area. The pain that I was getting from the pinched nerve in my leg has gone away. God bless. But I know that there's going to be a long journey ahead, and I just want to document my process and my recovery process with you guys, and give you some insight and hope if you are someone that's looking to get a similar surgery. So right now I'm just going to give you a rundown of my story and how I got to this point, and then just give you an idea of what I'm experiencing, the pain that I'm experiencing, and then I'm going to make, every couple of days I'm going to make a video to just give you guys a little update and what to expect moving forward. So my story basically about my injury, my back issues, dates back to 2006. I was doing some lifting and I lifted incorrectly and a little bit too much than I was supposed to, and I just felt a slight little pinch in my back. I didn't think anything of it. I just thought I pulled my back, I pulled a muscle, and I go to the doctors. I explain my symptoms, I explain what I'm going through, and I get an MRI done, and I had a slight disc herniation. I was prescribed pain medication, physical therapy, and was told in about a few weeks to a month it will heal and I'll be back to be able to do lifting, working, whatever. So for the next couple of years, I had back issues, but it wasn't anything crazy. It wasn't anything close to the pain that I felt in 2006. And I continued to make sure that I didn't lift too much or I didn't lift incorrectly. And I made sure that I at least attempted to not put any strain on my back. But about 6 months ago, I was working out and I felt similar to how I felt back in 2006. I had an idea that this could possibly be a disc herniation, but I put it off and I said, you know what, maybe not. And as the months went on, it progressively got worse. I was prescribed some steroid medication to see if that would help with the pinched nerve that I was starting to feel, but it wasn't as bad as close to a couple weeks ago. And as the time went on, I was progressively getting worse. It started in my butt area, and then it was slowly migrating down all the way to my toes. I wasn't able to stand for more than a few minutes. I couldn't really walk long distances. I was laying down a lot. And emotionally and also physically, it was really getting to me. I knew that there was a problem, and after getting the MRI to confirm that I had a severe herniated disc, this time triple the size than back in 2006. So I got a epidural injection, and I was told that should relieve the pain. If not, we're going to do a follow-up checkup in a few weeks. We'll come back and we'll reassess the situation. I said, okay, that's fair. So I get the epidural shot, and it felt worse. I didn't feel better at all. My symptoms got worse, the pain got worse, the tingling in my toes, in my leg was getting much worse, and I told the doctor, I'm like, look, I can't do this anymore. I can't endure this pain any longer. I have to get surgery. And they confirmed that. They said, we agree, you need to get surgery. So after my follow-up a week later, I am where I am right now. I got home a few hours ago. Thankfully, the surgery went well. Everything went smoothly, and right now I'm just recovering. The pain that I was experiencing in my leg has now gone away, but I am experiencing a lot of pain in my lower back area, a little bit of tenderness and soreness, and if I lay down too long, it starts to hurt a lot. But I'm very, very optimistic about the future. I knew that this needed to get done, and I know for some people out there, you're on the fence right now. You're like, should I get the surgery? Is it gonna really help me? Is it not gonna help me? You know, if I get surgery at mind you, I'm 28 years old. I'm a healthy person, but sometimes stuff like this happens, and it's not in my control. If you feel deep down that you need to get this surgery, and you talk to your doctors and you get second opinions, and they recommend this, you know, I was hesitant and I was really worried and I was nervous, and I said, you know, I was thinking the worst case scenario when it came to the surgery. But like I said, I'm very, very optimistic of what the future holds for me, and how my back is going to heal up, and I'm not going to have this nagging pain in my leg all the time. I wasn't able to work. I wasn't able to do daily functions. I wasn't able to, you know, be with my family. I wasn't able to hang out with my friends. I wasn't able to do anything. And, you know, after a while, that takes a toll on you. And it took a big toll on me, because all I was doing was I was home, I was laying down, I was just thinking about the pain. I was thinking about, you know, what if I did this, or what if I did this differently? And then I was trying to think about what exactly I did wrong. Why did I work out at that day? I shouldn't have. And just thinking about all the different things that I could have done differently. But in reality, I wasn't realizing that I have this pain, I have this problem, and I need to deal with it. So I said, you know what, I'm just gonna get this surgery, and I'm just gonna get it over with. And the pain is gonna be it's gonna be tough, and it's gonna be really tough for the next week or so. But I know for a fact, moving forward, I'm gonna be in a much better place than I was about a month ago, and just yesterday or a week ago. So I just want to give you guys a perspective, and just give you guys an idea of, you know, what to expect and all these different things, because again, there's going to be pain, but the pain that I'm experiencing now for the next couple weeks, it's going to be nothing compared to the daily pain that I was experiencing for months and months and months, and not able to just do anything. So I hope by me making this video, it just gives you guys a glimpse of what I'm going through, and I'm going to give you guys an update, and I'm going to let you know how I'm feeling on certain days, and I'm going to give you an insight on my physical therapy that I'm going to have to go through, and all these other things. So I hope that if you are on the fence of getting the surgery, that you make the best decision for yourself. And all I can say is this: we live in a country that has the best surgeons and the best medical care in the world. So I'm so blessed to be living in this country, because I was really nervous, and they made this process very, very smooth. And I'm really grateful for the staff, the surgical center that I went to. They helped me out a lot. They took care of me when I was there, and they really went over everything, and it was great. So if you are on the fence again, don't be nervous, and just remember this: the pain that you endured for so long is going to be short-lived after you get this surgery. And I'm so happy to say that a couple months from now, I'm going to be able to get back to my life again. And I'm going to be able to do all the things that I talked about before, being with my family and all these other things. Because this back surgery this back problem, I should say, has just taken such a toll on me. And I just want to voice this, and I hope I could just be a glimmer of hope for anybody that was in a similar situation that I am. And good luck if you are going to be getting the surgery, and I'll keep you guys posted on how I'm doing. So thank you so much. Have a blessed day. Bye.